for the monthly staff meeting, but I wanted to take this opportunity to talk to you a little bit about LVADs. LVADs are left ventricular assist devices. They are used in patients who have advanced heart failure, either as a bridge to heart transplantation, meaning that they're waiting for their heart to become available for transplant, or as destination therapy, meaning that a patient is not eligible for a heart transplantation for whatever reason, and an LVAD is implanted as a destination therapy that they will have in them until the day that they die. I just wanted to give a very high level, quick overview of what an LVAD is. It is essentially a mechanical heart. It's inserted in an open heart surgical procedure where the patient will undergo a full sternotomy. A very large cannula, as you can see in that picture on your screen, will be inserted into the left ventricle, and then the return cannula will be inserted into the aorta. In between, you can see that is the pump. It's a continuous flow pump that is connected to the drive line, which exits the skin around the right upper quadrant. That continuous flow pump is continuously flowing and circulating the blood. Oftentimes, patients with an LVAD will not have a palpable pulse. Some may have a weak palpable pulse if they also have some intrinsic mechanical contractions that are happening simultaneously, but a lot of the time there will be no palpable pulse. The drive line exits the skin and it attaches to the controller that the patient wears on their belt. And then you can see on either side the battery holsters, and the patient has to charge and change batteries every 12 hours. It's imperative that these patients have access to electricity in their homes. Additionally, when we do admit them, we have to get them on the shelter list in the event that there is a power outage. That's a very important piece of care for these patients once they're discharged home. We do have some progress to goals in the template library in WellSky. It's very important, and myself and the rest of the One Heart team will ensure that the patient's LVAD or advanced heart failure team contact information is readily available in their chart, and that will be found within the patient's progress to goals. Also, it is important to note that the patient and caregiver have to be completely independent with the care of their LVAD, including driveline dressing changes, managing alerts and alarms on the controller, and battery changes and power checks daily. So that is the responsibility of the hospital and the LVAD team to ensure that the patient is competent by the time they reach us. Our responsibility is to ensure that the patient knows who to call in the case of any questions that we can't answer. That, of course, would be the LVAD team. And then also our responsibility is to educate the family and the patient that if there's any alarms going on with the patient's controller, or if they're not feeling well, they need to call 911 and they need to be assessed immediately. It's not something to take lightly. If a patient is not feeling well, they are a very high risk for device thrombosis in that pump that you see. So they're oftentimes, unless they have some bleeding complication, will be on anticoagulants. So they can have a variety of bleeding issues because of that, as well as if they're subtherapeutic on their Coumadin, they are at high risk for stroke because of clot formation. Additionally, they're at very high risk for driveline site infection. So asking the patient about any temperatures they may be having or any increased pain at that driveline insertion site is very important at your in-home visit. And then additionally, asking whoever is performing the driveline dressing change, it's typically a caregiver or loved one, asking them, how does the driveline site look? It's not recommended that we witness or watch the driveline dressing changes, as it is a very strict sterile technique procedure that's done in the home. So minimizing any potential contamination with having people there that don't need to be there is ideal. So you are not responsible for viewing their driveline dressing change technique or anything like that. That is something that the patient and caregiver are responsible for. However, when you are visiting the patient, you can ask the caregiver questions such as, is there increased redness at the insertion site? Is there any drainage? Is there any increased pain at that site? And those would be very important findings to report to the patient's LVAD team. This is just the start of getting these advanced heart failure patients and LVAD patients. We got our first one from Tampa General last week. We will be seeing more coming from Tampa General as well as Cleveland Clinic. And as NCH increases or expands their advanced heart failure program, we will be starting to see those patients as well in our communities. So it's very exciting, a lot of changes. If you have any questions about LVADs, please feel free to reach out for me, and have a great rest of your day. Thank you. Take care.